I want to kind of throw this out there as a question for any of you that want to answer. What do you want people to understand? What is important for people to walk away with today regarding the COVID cabal?
That they're still using it. They're still killing people by design. This was all planned ahead of time. It's being executed to kill as many American citizens as possible. And we have all the data, proof, everything, to back it up. I have a friend that vents people at Clovis Community Hospital. She said when they were using hydroxychloroquine, 14 out of 16 people survived the vent. After remdesivir was introduced, everybody died in mass. All the medical records are the same. You could get on the NIH website right now, type in the remdesivir. They admit that it kills people, that it was pulled from the Ebola study, because it had over a 53% death rate. So why is that the only drug mandated to be used in every hospital across America?
Yes. Yes.
And I'd like to add to that. I would tell people, be prepared. You really need to make sure you have your supplies in your house. Stop try to prevent as much as you can from having that need to go into the hospital, because the hospitals are not safe. I think most people in our country know that when you're sick and you're not feeling well, the first thing that they do is they hang up an IV bag with fluid, maybe start you on an antibiotic, depending on what's going on. None of these things are happening. The standard way of care is out the window. And stop testing, for crying out loud. Stop testing for COVID. You are starting the domino from that point on. And I know too many people, and I can't even listen to the word COVID anymore, to be honest with you. Every time I hear somebody going into the hospital, I cannot help but be concerned for their lives. I don't have that feeling like, let me go to the hospital so I can get help. No, let me go to the hospital so they can kill me. That is what is going on in my mind. And the hospitals are not safe. Stay the hell out if you can. Make sure you're not alone,
Yeah. And keep in mind, for anybody that hasn't listened to, Dr. Peter Hotez has already warned that on January 21st, all these horrible viruses are going to be hitting the world. That means that if we're going to be accustomed and accepting of federal guidelines that tell our doctors how to do their jobs, that will continue, and it will only get worse in the hospitals. When we look at the number of nurses who have left the ICU and ERs because they couldn't stand it anymore, losing so many patients when they knew something was wrong and they could not protect their patients. And you've got a few doctors who have done the same thing. They've all left the hospitals. That means that the people that are left are not the critical thinkers. They're not questioning anymore. So every time you go to the hospital, you're dealing with people who are willing to take orders from either insurance companies or the government, and they're not doing everything that they could to save a life that they should have been trained for, but they don't have any kind of discernment about that. Very aware. You need to have somebody with you that is an absolute pit bull when it comes to protecting your health, because you're sick. You can't make that decision all the time. And the other thing that you need to do is just remember, if you can find a way to have a functional doctor in your background, then you're covered, because you're going to, when you get sick, you've already got somebody. I don't care if they don't take your hospitalization. If your insurance doesn't cover them, you're probably investing really good money in this doctor who will keep you out of that death hospital.